Okay, I think we're good to start now. Um, yeah, so good day, everyone, and welcome to the first public webinar of the HE² Center. My name is Ijeoma Solarin, and I'll be your host today. Um, I'm really excited to have with us a very distinguished panel, which includes very senior members of the HE² Center who will be sharing their insights, views, perspective, etc., on how the HE² Center works and the work it does. So I'm just going to do a very brief introduction to the panel. I mean, there's a lot more that we can say about them. So this is just very, very brief around them. So we have Professor Matthew Chersich, who is the director and research professor at the Wits Planetary Health Research Division and is a HE² Center lead PI and director. We've got Dr. Sibusisiwe Makhanya, who is a research scientist and senior manager at the IBM Research Africa Johannesburg Lab and a HE² Center co-PI. Professor Guéladio Cissé, an adjunct professor at the Université Pelefero Gon in Côte d'Ivoire, and also a HE² Center co-PI. Professor Stanley Luchters, who is executive director of the Center for Sexual Health and HIV/AIDS Research in Zimbabwe, and a deputy director of the HE² Center. And last but not least, Lisa van Aardenne, who is a principal scientific officer at the University of Cape Town's Climate Systems Analysis Group. And she provides leadership on issues of climate data and analysis for the HEAT project. So thank you all so much. We all know how busy each and every one of you is, so it's a real privilege to have you all here with us today. Before we start, so the program is we're just going to have some questions for the panel, and then we move into a Q&A discussion afterwards. But before we start, I just want to put in some quick housekeeping rules. So this webinar is being recorded and will be shared on the HE² Center YouTube channel. So please look out for it and share it widely amongst your network. Please do keep your mics off, unless if you have a question and you're selected to ask it by the moderators. Otherwise, please take note of any questions you have during the discussion section or while the panelists are speaking, and put them into the chat, and then we can address them at the appropriate times. And so that's it for me for now. I will hand over to Professor Chersich to give us a brief intro about the HE² Center. Matthew, I'm guessing you're here, so please, the floor is yours.
It says I can't share currently.
Oh, okay.
You should be able to share now.
I am, yeah.
Go ahead.
Excellent. Good day, everybody. It's a great pleasure, and also I see that many of the data providers, people who are sharing the data with the team are online. So it's a great pleasure to see some of you and those who've been emailing back and forth over the last, I guess, 2 years we've been working together on this project. So I'm going to briefly cover what are the priorities and progress within the HE² Center, and I'm presenting on behalf of quite a large team who works across Africa, in Cape Town, Johannesburg at Wits, and CeSHHAR in Zimbabwe, as well as the UPGC in Ivory Coast, Michigan, IBM Research in Johannesburg, and University of Washington. So I think just 2 slides on the background. I think everyone on this call is well aware of the really serious problems that the world is facing in terms of the rising carbon dioxide, which is mirroring the emissions, greenhouse gas emissions, which also continue to rise. And in parallel, the temperature is increasing. And this is the kind of the curves that one would hope that the COP meeting would take seriously and begin to take measures to help some of this, rapidly worsening situation. I think this graph is for me one of the simplest way of showing how temperatures changed in the globe. So the grayish background area on the left shows the kind of average temperatures in 1951 to 1980. And then you would see there were some days where there were some hot and maybe perhaps a few extremely hot days. But that curve has shifted to the right, such that you're now getting very extremely hot days, those that were never seen before, And really this shift, and as emissions continue to rise, that means really that the shift will continue to move towards the right. So what this is manifested in is temperatures above 50 degrees. And this is just a period, a 12-month period. And really in many of these places, you're approaching the temperatures at which one can no longer thermoregulate. It's just physiologically beyond our bounds of adaptation responses to manage those temperatures. And any increases above those levels is when you're going to start to really see quite large mortality or morbidity events. The human body just cannot cope at that level. So I think that's a little bit of the background to where the world is at the moment. This slide shows what I think a public health response to climate change would take shape in. And anyone who's worked in public health in any field of disease control, of substance control, of hazards, infectious diseases, this is the classic approach. So underneath all of that is surveillance or indicators. And the HEAT Center is really focusing on surveillance, on understanding what happens. And so the HEAT Center will really lay the basis for measuring what does prevention mean. That's around emissions reduction or reducing exposure. What is care or adaptation? What services do you need? And then what treatment is offered for those who are affected. So, all health responses, if one thinks of COVID, infant vaccine coverage, all health exposures have a solid surveillance platform in place. So you can track how bad is it, how is our response, who's most affected, etc. And currently in climate change and health, there just isn't a surveillance platform. The indicators are really poor that we're working with globally. So I think this work is important in terms of making an Africa-specific measure of the impacts of climate change. This just shows one slide that this is, for those who are familiar with meta-analyses, all the studies, around 200 studies that looked at heat in pregnancy. Almost all of those studies in meta-analysis were to the right of one. So that showed that heat impacted on all of those outcomes. But there's a lot of gaps, and some of those numbers are small, and there's multiple different designs, and each of these have major problems. So the idea of the HEAT Center is to have a systematic approach where we pull all the data, we identify it systematically, we pull all the data from across the continent, from cohorts and trials, and you apply one system, one set of exposures and one analysis technique in a systematic, planned manner, that where the data is then interpretable. So number one, we identified cohorts and trials. We then contacted the data providers, the process of data transfer agreements. Step 3, step 4 is the harmonization and analysis of data, and then step 5 will be this indicator development. So this has been ongoing over the last 2 to 3 years, and it's a pipeline of data that moves along. So this shows that pipeline in a different way. The top oval shape shows that we obtain biomedical data from multiple sources. We then pool it. So different cohorts, one in Cape Town, Safe Passage, or one in Johannesburg, or all these cohorts and trials, you pool them into one database. You then merge that. That's the central core database which UCT is hosting. And that then has the biomedical or health data, and also then climate environmental data, but also other data on socioeconomics, the census data, any other data source that we can then merge into this database where it's relevant. Then you apply data science or traditional stats, and then the knowledge dissemination and public health solutions like indicators or others. And Alice and her team plays a key role in that second last box around dissemination. And today is an example of that, I guess. So that's the maternal and child health component, where we aim to develop this indicator. The next component is in Johannesburg and Abidjan. What it aims to do is look at urban heat islands. So these are two really important cities in Africa in terms of the economic importance, but also the urban heat island and the disparities, etc. So this shows we can't treat Johannesburg as one city. We need to break it down into which areas are more vulnerable, which vulnerable economically, geographically, in terms of vegetation coverage, service coverage, etc. So this, the second part of the heat center, takes urban areas, and this is an example of great work done by the IBM team, where they have taken Abidjan, Johannesburg, Abu Dhabi, etc. They've taken these areas and they've applied very sophisticated modeling techniques to break down and understand which areas are most vulnerable to heat and how they're distributed, and a vulnerability index. And the University of Cape Town has done similar work where they've applied various climate models to examine really what is as close as possible to the kind of truth in terms of exposure. Elisa, I think, will explain that more eloquently than I could. So some of the early findings, this is preliminary analysis. It hasn't been published yet, but these are some of the studies that we've processed that have been part of the pipeline. They've reached the end of the pipeline, which means that we've acquired the data, we've recoded it into a common set of variables, and then we've linked that geospatially, and the CeSHHAR team support a lot of the geospatial work, and we've linked it with the climate data, and you've performed some of these analyses. So this is some early work. This is the kind of graph that we'll produce over time, but it will be for different countries, different parts of Africa, different outcomes, and different exposures, which I think is important. That not all heat is, there's various kind of exposures that affect people differently in different parts of the continent, because of adaptation and because of your availability of trees or water or areas that offer protection, or on the other hand, areas that are particularly vulnerable, like the Sahel, where there's very little protection really, and those areas are already highly vulnerable. So briefly, what this shows is the minimum mortality temperature. That's the base of the U-shaped curve, and in this case, it was around 22 degrees. And after any temperature above 22 degrees, you were starting to see an increase in relative risk. That's the line. The gray shaded area around that solid line is the confidence interval. And the confidence interval in his analysis was above 1. So on the right-hand side of the curve. So it's very unlikely that this shape is due to chance alone. And it reflects a real finding. So example, on the right-hand side, when the temperature is above 40 in these 4 or 5 studies, the relative risk of preterm birth was 1.4-fold higher than when the temperature was 22 degrees. So this is these U-shaped curves, and we'll come back to that. Please ask any questions. So the team is doing a diverse range of work, and I think, as you can see, it's a complex study, and each step on the way, there's really a lot of lessons the team is learning and interrogating each little step till you get to that final analysis. And it's really so pleasing just to see the quality of the outputs and the breadth of the work of the team. I'm just showing you a few of the outputs that we recently presented at the HE²AT conference in Zimbabwe. And I'll just run through these very quickly. The top left was the complexities of research. So how were we, in terms of gathering the data, interaction with data providers, and how successful was that process, and the challenges in legal and ethical concerns. Then the second, on the right-hand side, the second and the third boxes was how do you look at heat stress and heat exposure. Measuring heat exposure is very complex, and I highlight the one example there by Peter Marsh and his group in Cape Town. They were using very nuanced, subtle methods of understanding exposures. The bottom left is around air pollution. Of course, we're interested a lot in air pollution's interaction with heat. On the right-hand side is water, sanitation, and others in a systematic review by Guéladio, Cissé's team in Abidjan. And they also did work on understanding pregnant women and their villages, etc. Really grounded mapping. So we get a very comprehensive approach. And then on the right-hand side, second from the bottom, is some work within the Cheeky group, who's a spin-off or part of our project. That's led by the CeSHHAR team. It's kind of a study that is parallel to the heat center that tries to understand air pollution and how that interacts with heat. And then the bottom right, we have these pilot studies. I highlight there was an excellent pilot study by Elvis in Cameroon, where he looked at temperature, humidity, rainfall, and cardiopulmonary admissions. And here he demonstrated very clearly that at higher temperatures, you get increased admissions due to cardiopulmonary conditions in Cameroon. And of course, findings like that have resource implications, and also important to demonstrate the severity of climate change, etc. So this is our last slide. The top, just to summarize in conclusion, we have the top horizontal bar shows overall burden of disease. So some of that is obviously not attributable to heat, and some is. So then let's pretend that top vertical bar is preterm birth. There'll be a portion on the right which is attributable to heat. So, as we demonstrated, some parts of preterm birth is due to heat. But heat is divided into that which occurs naturally. There's always been heat waves. And that is due to climate change or attributed. And this project, I think, really aims to get into that subtlety and to understand the burden of disease in a very nuanced manner, which is essential for driving the public health approach to climate change. So just to acknowledge, this is definitely a strong, diverse, transdisciplinary group who work very closely, very productively together. And of course, it's funded within the DSI Africa program, which is this remarkable program across Africa with around 30 projects, I think, that the NIH has funded across Africa. Thanks, Ijeoma.
Yes, great. Thank you so much, Matthew. That was a lot to take in, a lot of information, and I'm sure, we might get some questions later on and we can dig into various aspects of what you spoke about. But thank you so much for the overview. Yeah, so it is a very complex project. There's lots of bits that go into it. And I think as we move into the panel discussion with the panelists, we can hear sort of their specific perspectives or roles within that whole system. So I'm going to start with you again, and I'm just going to ask questions to the panelists, but I'll start with you again, Matthew. Since you ended, you might as well. So I think you touched a little bit on this, and maybe we can expand a little bit more, but a lot of the work that the HEAT Center is doing around harmonization of data and creating a useful data set. So that's a lot of work we're doing is around creating this harmonized data set. How do you think this adds value? What value do you think this adds in the real world? I think people kind of see, okay, we're doing all this work and we're collecting all this information, we're harmonizing all this data, and finally you talked about surveillance, but maybe you can also give some other ideas about what the potential is for this harmonized data set that we put together as part of the HEAT Center.
Thanks, Ijeoma. So I'll try and be brief because I know that there's a lot of people who can explain many of these things better than I. But I think the efforts that it's taken to pool all these different products together and then harmonize it all into one database is really considerable, and very few people have undertaken this. I think, as far as I know, we're the largest attempt at pooling this kind of data, and so there's a considerable amount of work to do it also systematically. But once you've done it, you can answer questions that you cannot answer with single databases alone. And I think the way that things have been done, there's each study doing individual analysis, their own methods, their own biases. They will never be able to answer the questions that we just can by doing it in this way. And the other point of having this database prepared, I gave some examples of understanding air pollution, but you could also understand what are the impacts of water, or of unsafe water access. But you can also use the same database to look at questions in maternal and child health. So in other words, if you remove the climate change, but if someone wanted to know what are the rates of diarrheal disease and what is it due to, what are the effective agents in Africa, one could reanalyze that data. Because the most important feature is that this is cohort and trial data, which is the richest data that one can find. This is not birth registry or DHIS or facility. This is trials where people have hundreds of tests followed up over time to be able to do longitudinal analysis.
Yeah, no, thank you. Absolutely, Matthew. I completely agree with you. So I have been part of that background trying to do the data acquisition aspect of these things, and seeing all the quality data sets that have agreed to share data with us is amazing. So I think it does have that huge potential to analyze various things. I'm going to move to Sibu now. So Sibu, can you just tell us, how is this work pushing the frontiers of AI/data science?
Sure. Thanks for that, Ijeoma. Maybe I'll just dovetail on the question that you did pose to Matthew, just as a beginning. Obviously the data acquisition process, we are looking at over 200 studies coming from all over the continent. Obviously, one of the challenges is we're not getting this data, at one single time point. So we are acquiring data as the project is proceeding. Now, one of the challenges that this poses, it's obviously a manual process to actually create this single harmonized data sets when we have data sets coming from various studies, which are all very different in terms of what the purpose of the initial study was, and therefore what kind of data was actually collected in that particular study. So that has actually provided the team with the opportunity to say, look, doing harmonization of the data, we've developed a process, but there's still some elements within the process that we feel are a bit repetitive, and they do require a lot of manual input. And so the question is, can we develop a process that may leverage AI to help fast track basically this process of harmonization? And with that, obviously there are tools around just to clean the data, to transform the data, and so forth. So that has provided the team to really get to thinking, how do we leverage AI tools to look at data harmonization a bit differently, even the production of code books a bit differently. We are obviously in a very niche kind of area as the HE²AT Center, in that we are looking at health data and climate and environmental data. And these two data sets, differ in their format, and the type of data and the way that they are stored. So it's challenged the team, but I think it's challenged the team in a good way, in that we are also starting to say, how can we leverage AI tools to actually maybe change the way that data harmonization is actually done, specifically in the areas of environmental health. So that is the first point. The other thing just about the data itself, because there's issues just around its quality. So there is a requirement, for special attention. And this is not just on the health side, even on the climate and environmental data side. We find, for example, if we're working in Joburg, yes, we can get, good LST information, or land surface temperature information. But when we move into areas like Abidjan, where there's a lot of problems in terms of cloud cover, there is an issue in terms of the data being incomplete. So one of the things that we are really trying to leverage AI for is to say, we can really look at larger areas, train models to kind of understand how land surface temperature, the broader distribution, what that is like, and then use that type of information to then predict in some of the areas where we don't maybe have information, but also some of the areas where it may be difficult, the information is a bit incomplete. So we're using it for such instances as well. But I think it's also opened up an opportunity, because we're working with such an interdisciplinary team, and we're actually working with specialist climate scientists. There is an opportunity to say, how can we leverage the strengths of both the physics-based models? We know that they are grounded in the actual physics in terms of, the circulation from a climate perspective, but then leveraging the power that we can get in terms of learning patterns that we may not easily articulate in terms of our physics-based models, leveraging the two pieces of information and form what are called more hybrid types of models when it comes to modeling climate. So those are evolving conversations that we are having within the HE²AT Center. But the other thing is it does pose an interesting question, because at the end of it, we do want to look at what is the impact of heat on health. And so it's very important that we have a good sense of what are the uncertainties that we actually are developing or incurring as we're looking at leveraging hybrid or even AI types of models when we're looking at modeling exposures, which are then propagated into our health models. So it opens up an interesting discussions around data quality, the effect that it then has on uncertainty, and how do we quantify that as we move from the spectrum of maybe leveraging AI models to moving to maybe more traditional stats models as we do the last mile, which is the health impact side. I think even we've also seen that, as part of the HE² Center, there is this thinking afresh when it comes to things like how do we incorporate aspects of vulnerability when we're looking at, heat impacts on health. How do we capture that? Specifically because we know that there are differences in the types of environments that people live, and the impact that then has in terms of the felt experience from a heat perspective. But I think the real power in terms of just working through this within the context of a HE² Center is, yes, we could apply classical machine learning models or the more foundation models when it comes to the more generative AI side of things. But having those health experts in the room really helps to make sense, actually, that in this particular area, yes, it is a well-developed area, but because of the characteristics from a disease burden perspective, we're seeing that we're getting higher values for vulnerability, let's say, but these are the contributing factors, and to help make sense of that, because I think that the challenge is, yes, there are tools that could be leveraged both from a classical and more advanced generative AI perspective. But the important thing is, does it then make sense in the context of the problem that we are actually studying? So I think I'll stop right there, but those are the points that I did wanted to highlight, that it's been exciting because we've seen the opportunities to actually leverage AI for all the challenges that crop up in terms of the HE² Center and the work that we are trying to achieve.
Thank you so much, Sibu. I mean, as I listen to you talk, and it's probably going to come up with all the other panelists, you always think if something is really easy, everyone will be doing it. And it's like, and that's part of the thing. And I think the thing that also speaks to me is all these pre-processing that needs to happen before we get to even, work on analyzing that data, and all the work you guys are doing, and that just the potential of outputs that can be used in various aspects, not just in this climate and health space, but in various things. So it's really amazing. So thank you very much. So I'm going to move to Stanley now. Stanley, a big part of the HE² Center is the focus on capacity building. Does he take a novel approach in this regard? And are you already seeing benefits of this?
Yeah, thanks, Ijeoma. Hope you can hear me well. And thanks everyone for joining this webinar. It's really exciting. So around capacity strengthening, I think the HE² Center creates a lot of opportunities for various members of the team and outside the team, in fact. And so when we designed the HE² Center as a proposal, one of the things we did was to set up a separate training and engagement core, but with a very strong sort of training aspect to it. So really an integral part of the whole program. So capacity strengthening sort of varies. I think there are sort of more traditional sort of approaches, and that we have our monthly webinars that we run that are broadly attended. We also have PhD and postdocs that are building on the HE² Center work. And especially in Côte d'Ivoire, I think the team has done really well in utilizing the HE² Center to build the capacity of PhDs. And and postdocs, where I think maybe there's some sort of more novel or outside the box capacity strengthening is happening is maybe through some of the sort of staff exchanges that we have seen. And I think the HEAT Center is quite unique in that we cover sort of the different parts of the continent with presence in West and Southern Africa. But we also have public as well as private entities, and the staff exchanges are really helping to sort of build capacity of the team as well. Maybe just building on that, I think just being part of this, multidisciplinary team and the multidisciplinary work that we're engaged in, from the climate sciences to the health sciences, geospatial sciences, data science, all of these, just the interactions and the collaborations is strengthening the capacity of everyone, including myself. What I also wanted to highlight maybe in terms of capacity strengthening is that the opportunities that exist through the HEAT Center in terms of things like pilot projects, I think they have really helped provide small grants to emerging researchers to implement their ideas. So I'm having a bit of a storm on my side. I hope that doesn't disturb you. But besides those pilot projects, I think where the HEAT Center has also done quite well is in assisting sort of early and mid-career researchers to apply for supplementary grants that are part of this Data Science Initiative Africa. And so we have actually a few successful sort of grants for mid-career researchers, often from varying institutes collaborating together, having their first or second PI grant to implement. And I think that's really important to build that next generation of research leaders. And so I'm quite pleased with that. Maybe just one more that I was thinking of in terms of capacity strengthening is that this year the HEAT Center organized their annual consortium meeting, sort of alongside the Climate Health Africa conference that we organized and held here in Harare, Zimbabwe. But that was a fantastic platform for many of the team to present their work, but also for other people attending the conference. And we had over 450 delegates to hear sort of what the HEAT Center is involved in and share our experiences and new knowledge. So I think that capacity strengthening, an integral part of the program, and I think is really helping and happening at various levels within the program. And I'm sure I'm still forgetting a number of them, but maybe leave it at that.
Thank you so much, Stanley. No, definitely. I mean, we can feel it in the HEAT Center in terms of the capacity building. And when you talk about the pilot projects, and I know like last year's pilot projects, they had all these various webinars about what they were doing, and that's propelled them forward as well. And definitely the CeSHHAR conference, seeing the number of outputs that came out from the HEAT Center at the CeSHHAR conference. I mean, we had people talking to us about it the whole time. So absolutely, I think there is a lot that's going on in that capacity. So moving on to Prof. Cissé, who is joining us from COP in Azerbaijan. So yeah, right on the front lines right there. Prof, I know you've had, meetings in Abidjan over the last few years where you've invited various stakeholders while you were there. And so I was just wondering, like, what excites non-academic stakeholders in Abidjan about this work?
Thank you very much for the question. I think even before talking about the non-academic researchers, I saw an increasing interest from the academia. I think if you look from the first workshop to the third workshop this year, the number of professors, supervisors of the students, or the universities who were really enthusiastic for attending our workshops was really amazing. It's because they understood better what does it mean to use data science for revisiting some other data that maybe there will be in archives, and now how this new science is giving a new life, respond to some research questions that maybe the original data owners did not have. And they were all excited about what does it mean using AI and everything, all the methodologies that Sibu talked about. But for the non-academic actors, maybe you are referring to the workshop that some colleagues from South Africa attended already, and this was impressive. I will talk about three categories of those non-academic stakeholders. You have those at really high level of the central government, for instance, like the direction in charge of meteorology. In Côte d'Ivoire, they call it SODEXAM, and like the Minister of Health. So what made them very much interested by this is that it's a very concrete research project saying at the level of Abidjan, how can we get a very effective early warning system that reaches people in the ground? For them, for example, for SODEXAM, they are able, their capacities to issue what they call bulletins, showing even some alert about heat waves coming up soon. But they have no knowledge of how these warnings are reaching the ground. So our project is showing up the vulnerability.
Apologies, Prof. You're
And
breaking up a little bit.
Assessment stop moving. So the one point also is, do you hear me now?
Yes,
Is
we
it
can
better?
hear you now. We can hear you now. Yeah.
Okay, now. So one aspect is also to move from only assessing vulnerabilities at different places of the country, but also in the urban context, where are the poverty pockets, where are the most vulnerable people? And our study, with its clear objective of looking at the heterogeneity in the city and how the early warning system could be tailored to the diversity in the geospatial or in age groups or most vulnerable people, is of most interest for them. So they attended to all our workshops, and they are collaborating with us in a very, very, very strong manner. And the last group, not the least one, it's the communities. So at the first workshop, we thought that the participants should be visiting at least two places in the city. One, which is a really wealthier place. It's even the residential area of Cocody. And another area would be very informal settlement, very underprivileged area, under-equipped. And when we're crossing that area, we met, for instance, one woman, and she gave birth in March while we were visiting in May. And this took us really deeply in all of the participants. And the next year, we invited from that community herself, a representative from the youth, the representative of health center, major, we call it the majordom or the major, and we had also the leader of the communities. And I can tell you that they were themselves so much happy with that exposure that made them express how these warnings that the SODEXAM are creating intellectually are not reaching them. But also for the audience, it was really something that became as an eye-opener, very strong, because hearing from the people themselves in a panel that was dedicated to the early warning system alone, when it's confronting communities with all the structures that are supposed to put in place early warning system, I think it created a lot of interest for all the people who were present in the meeting. And in our third workshop last year, incredible, all the stakeholders, from the communities to the researchers to everyone, we organized in the collaboration with WHO regional office in Africa, an official roundtable at the end of the 3 days of workshop, where these parties, no academic actors were present. And I can tell you that it's really, really, really showing some kind of expectation that at the end of this project, we'll most probably reach something that will respond to the needs of people, vulnerable people in the ground, in the poor settlements even. I hope that with my excitement myself, it gives you an idea of how everyone now, we succeeded to bring them in a level of excitement about the outcomes of this project.
Thank
Thank
you,
you.
Prof. Thank you so much. Yeah, no, absolutely. And I think you know what, this is all the increased interest in all the workshops that you've done in Abidjan, you know, it's like, and the engagement that we've had, it's all, you know, like a testament to the amount of work you've put into kind of getting people together. So it is amazing. But yeah, thank you so much. So now I'm going to ask Lisa, you've worked a lot around this, but what are some of the major challenges when trying to bring together climate and health data to see important patterns? So you come from a climate scientist point of view, and now you're having to deal with health data. So maybe you can highlight some of those major challenges for us. Thanks.
Sure. Yeah, so I think the primary issue is that we're combining very different types of data together. On the one side, you've got the health data. That's, you know, it has its incredible strengths, but it also has some issues, and it can be very difficult to work with. For instance, having to deal with the legal and the ethical side of things has been quite an experience for me. But then on the other side, you know, climate data is also it's not quite as simple as many people think. You can't just pull it kind of off the shelf and use it. And so with this project, we really do, thankfully, we've got some really strong resources, both in, well, people with incredible knowledge, both on the climate side and the health side, and then also all the other fields around that to allow us to do this work. I think what's also interesting is that health data is primarily participant-centric. You know, all the variables that are collected around that participant, whereas climate data is it's a geospatial data. We're primarily concerned with how, for instance, temperature changes over space and time, and you know, location and time is not always recorded in the health records, and obviously the participant is not kind of studied through, you know, throughout her whole pregnancy. It's just instantaneous snapshots through her pregnancy that you have. And so we often find ourselves in this interesting position where we have many different climate data sets, and we need to, you know, look through them and go, what is the most appropriate data set to use? And there is no perfect single data set for us to use. It's always going to be a compromise. We always asked, we want the highest resolution data set for this specific place. You know, I want hourly data at, you know, 500 meters because we're looking at urban setting. And you're right, that would be fantastic, but that's not available. And so we have to come to a compromise of what is good enough for this analysis. So yeah, that is something we need to work with, and that's what's going to be really useful in this project is we can play. We can go, okay, so we've got these two very different types of data. How can we use machine learning to see which variables are going to be the most informative? Do we want to do it with one, you know, a lag of one? Do we want to use just the last 10 days of climate data to look at what the, you know, the health impact is? Or do we, you know, look further? So we allowing, the machine learning allows us to play with the data and to find the patterns. I think also what's really, really useful in this study is that we're looking not just in one location, we're looking across Africa for the one project. And so we need to look at, obviously the climate varies, but so do the population. Different populations will be acclimatized to their local climate. And we need to bring that in to better understand the climate impact in different locations within Africa. So yeah, there's a lot of really interesting questions that we have. And obviously another thing is that people move. We're trying to, link each participant to the weather they experience, but we're not quite sure where that person is. We can sort of assume that they're going to be in their home at night, but where they go during the day, we don't always know that. What kind of house do they live in? Where do they work? What kind of work do they do? All this has a huge impact on the results. And that's why this isn't just a climate and health project. We really need to bring in the socioeconomic information that we can find to really understand the relationships. So yeah, I think I'm going to leave it there because I don't want to take up more of the time.
Yeah, thanks so much, Lisa. I mean, I think as with everyone, we can talk a lot about all these different issues and all these different challenges. But yeah, and I think well, that is one of the benefits of trying to use this clinical trial and cohort data, is that hopefully we can get some of this more granular information and more quality information about these participants. But yeah, as with every research, there's always going to be some compromise along the way, and we just need to make the most of what we have, of the best that we can do. I think at this point, I'm going to sort of, have a quick pause here and see if there's any questions from those who are online, directed to the panelists. Alicia or Amy, I don't know if you guys in the background have seen any particular questions. Also, you can also raise your hand if you have a question that you want to ask directly to the panelists.
No question. Sorry, go ahead, Amy. I was going to say no questions on the chat as yet, but maybe I can be cheeky, and while people are thinking of a question, I can pose one. It's been great to hear from all the panelists and hear everybody talk about the benefits of working across disciplines, but also some of the challenges of working with different data sets. Let me turn my camera on. But I was wondering, and I guess any of the panelists can respond to this, what some of the challenges are working across disciplines, not necessarily only in terms of working with the data, because we've heard about that, but if there are any other challenges that come to mind when working in such an interdisciplinary team. And this can be posed at any of the panelists, whoever would like to take a stab at responding.
Stanley?
Hi, yeah, thanks. So maybe I can just sort of kick it off, and I'm sure there are other members who will add to this. And look, for me, the experience in the HEAT Center, working across the different sciences in this transdisciplinary team, has been incredibly exciting. And I think we've been forced to have, quite close engagement and collaborations. What I have seen as some of the main challenges is largely time. And so I think the intentions within the team are there, and the motivation is there, but to overcome some of these transdisciplinary differences take time to overcome, to understand each other, to be able to communicate. We have different vocabularies sometimes, and different approaches of how we do work. So I think it's been a true sort of learning curve, but I think it came at a cost, particularly time, from my perspective. I don't know, maybe some others have other ideas.
I don't know if anybody else has any of the other panelists want to speak or say anything about that. Otherwise, I can move to a new question.
Ijeoma, maybe just one quick point. So everyone else's, so I'm in the medical discipline, and everyone else's discipline feels so far away and so difficult to understand. But then when I have it in the other direction, and someone from one of these disciplines that seem far away, talk to us about medical, I don't understand why they find it complex. Our field is actually relatively simple. So I think a lot of the barriers between disciplines is that we both think that the other one's work is more complex than it probably is. And we think that ability to understand it is harder than it really is. So I think that's, I think we can learn from each other, and we can cross these, and we can understand each other's disciplines. But it's overcoming that kind of feeling that it's impossible to understand.
Yeah, I remember like asking Tatenda about how, like how to do a GIS plot and all the different shape files. It felt like a different language, but it's always good to have people who know these things in the background. Sibu, I see you've got your camera on. Did you want to quickly say something? And then I can move to the last question.
Yeah, maybe it was just to hop on the point that Matthew made, that it's also in the context of you're obviously working on the projects. Each one is focused on what they are working on in terms of priority. But I think, as Matthew said, we miss each other, or the opportunity to miss each other is greater because we don't realize actually there's a lot that we need to do just to bring, our counterparts up to speed in terms of what we are trying to, or what we are doing in terms of our own fields. We would communicate as we would communicate with our peers who are in the same field, but we don't take the time or notice that actually we need to also build those bridges in terms of bringing our collaborators up to speed with the language of our disciplines and what it is that we're trying to do.
Yeah, no, thanks, Sibu. And I suppose that's also part of that whole capacity building and all the whole learning, and it's a process. We only have a few minutes left, so I'm just going to ask one final question to all the panelists, and it's like a quick 1-minute overview of so when you think about the end of this project, right? What will be the most exciting output or outcome from this work for you? So just thinking about that. So I'll start with Prof. Cissé. I don't know if you're still there, and then we move across. So just a quick overview of what you think is the most exciting output or outcome from the work.
I think, as I started even to describe it, if you end up with this project, after having facilitated the setup and even the piloting on the testing of an early warning system that is satisfactory for all the partners and that reaches effectively people in the cars, in the tuk-tuks, in the places where they're faced, where maybe partnering with radio stations where people are listening music in cars, in the streets, where these early warning systems are really reaching people where it's hot, where it's going to have impacts on their health. This would be the exciting outcome I'm expecting from this project.
Okay, great. Yeah, no, absolutely. Thank you so much, Prof. Cissé. Stanley?
Thanks. So maybe I will stay in the capacity strengthening realm. And I think this project's output in sort of building the capacity of African research and research leaders, I think is so critically important. Having African research leaders advance the evidence base on the African continent.
Great. Thanks, Stanley. And we're already seeing that with our pilots. Sibu?
Yeah, I think for me, there's two things that I'm really excited about. So it's just around the harmonization, the protocol and processes that we're developing out of that, and the tools that will come out from that work, I think is really exciting. And then the second thing is, and it's when I was at the Climate and Health Conference, for most of the talks that delved into trying to look at modeling exposures to various climate extremes and the impact of health, was just this question mark around the actual definition of these hazards. And I think we have a real opportunity with the HE²AT Center, with the work that we're doing, both from a physics base and an AI base on looking at generating high resolution temperature data to start to look at various metrics of quantifying, heat hazard, looking at different indices, and actually starting to test, how these stand up when you're looking at the impact of health, and to really get to answer that question on, if I'm looking at what is the impact of heat on health, what is the metric of heat exposure that will give me basically bang for my buck. So for me, that's an interesting question that we have an opportunity to answer as a heat center.
No, absolutely. And we've seen that with the heat studies where there's different exposures that are used. So very useful. Lisa, and then Matthew. Lisa?
Yeah, I think I'm going to echo what has already been said. There's some really great science that I think is going to come out of this project, but I think also it's the community that it's building. I think that is a key thing. 4 years ago, I was a climate scientist who knew nothing about this kind of health space. And I know there's other people within the group who had no knowledge of climate. And I think that probably is, in the long term, it is one of the most important outputs of this project is the building of this community that hopefully it will just be the first of many projects that allow us to work in this field.
Right. Thanks, Lisa. Matthew, you've got 30 seconds.
So Lisa took the point I was going to make, but to say it maybe in slightly different ways, that this project shows what African leadership and the amount of talent that's present on this continent. We could manage to write a 1,000-page application, and we can manage to kind of do our work across the continent and draw. Just look at the number of people on this, joined this, many of our team members, to have grown and made this cohesive unit. I think for me, that's most remarkable. I do want to acknowledge Liana Olafia and the other, some of the other data providers who are on this call. So Liana runs this massive program across South Africa on fetal alcohol syndrome prevention, and she's shared her data with us. And without people like Liana, this work wouldn't be possible. So to her and others, we're really, really appreciative.
Absolutely. Thank you so much, Matthew. Unfortunately, I think we've run out of time. I'm just going to hand over to Stanley to say some closing remarks. So before I do, I just do want to acknowledge the people in the background who helped set up this webinar. So Alice, Alicia, and Amy, thank you so much. And I hope that, we would have a few more occasions able to have webinars going forward. If you do have any questions, please, you can always reach out to any of these three, Alice, Amy, or Alicia, with your questions, and we'll see how we can get those answered. And so with that, I'll say goodbye, but hand you over to Stanley for some final words. Thank you so much.
Yeah, thanks, Ijeoma, and thanks to everyone for participating in this webinar. I hope this really has been helpful, especially to some of the data providers who, as Matthew mentioned, we couldn't do this work without your support and collaboration. So a big thank you to that. I hope that today's sessions sort of gave you a bit of a sense of what the HE² Center aims to do, and I hope we managed to communicate that there are some big ideas that are being advanced here. And having been in the project for the last 2 years, we've really been trying to put our efforts in identifying sort of databases, trying to harmonize them. And as we look to the next sort of year and the next 2 years of the project, we will be transitioning more and more to analysis and to outputs. So hopefully, what we aim to achieve is that with our work, we hope to, inform, future decision making. I think Matthew at the beginning spoke about sort of indicators, development, and the choices of indicators that we hope to inform, data and information around what is the attribution of climate change to adverse health. So we really hope that our analyses will really start sort of impacting on that aspect in the year to come. So maybe just two small things before I really stop. So I think one thing that we will be taking up as a HE² Center is to really see sort of how data providers can maybe be more actively involved, potentially in maybe making some decisions around priority analyses. And we are trying to overcome aspects of data access that we are actively working on. But we hope to have, a close collaboration with all of the data providers going forward. And then maybe lastly is that there's still a long way to go for the HE² Center. But the discussions with the NIH about sort of next phase HE² Centers are already ongoing. And I would maybe suggest that we also get some active suggestions from some of our collaborators around how the HE² Center could advance its mission even in the years to come. So I see we're 3 minutes over the hour. So let me stop with that. A big thank you to all of you, and especially, of course, the data providers, but the whole team for your contributions. Ijeoma for moderating, Alice, Alicia for setting this up, and I hope this was an hour well spent and we can do this again. Thank you all.
Thanks, everyone.
Thanks, everyone. Thank you so much.
Thank you, Alice,
Thank you.
Amy, and Ijeoma.
Bye.
Great. Bye-bye.
Thanks, everyone. Bye.